Hello, welcome to Banyan Botanicals YouTube channel, where we share tips on healthy living and interviews with Ayurveda experts. And today we have a special guest. Eric Grasse is an Ayurvedic expert, and he practices integrative medicine and also specializes in functional medicine. So Eric, do you want to take a few seconds to introduce yourself?
Sure, Nadia. I'm a doctor of medicine, specializing in family practice is my board certification, but I started studying Ayurveda some years back, and as well as functional medicine. So I have an integrative practice here in Santa Fe, New Mexico. It's called Unity Medicine, and it's integrative medicine and Ayurveda. And I also practice a lot of functional medicine, which I'll be telling you more about later on in this discussion.
And yeah, I hear that you have a baby, so you're a family doctor.
Yeah, that's right.
That's really
Diapers
cool.
to diapers. Take care of them all.
Good. So tell us a little bit, what is functional medicine? How is it different from regular medicine?
Well, functional medicine is a movement, really. It's founded by a group of very bright MDs, PhDs, osteopaths, chiropractors, nutritionists. Probably some 25 years ago, the movement started and got its name. And I think that the originators of the functional medicine movement really called it functional medicine for several reasons. One is that it looks at functions in the body rather than breaking the body down into organ systems the way Western medicine tends to do. So in functional medicine, as practitioners, we look more at core functions in the body, which I can talk a little bit more about later. But also, it's a medicine that is functional as opposed to a dysfunctional medicine, which is, I think, the way a lot of people feel now about Western medicine, especially the current healthcare system, is that it's not exactly serving the people and their needs, and so it's kind of become dysfunctional. So over time, functional medicine has taken on a double meaning in that way. So I'll go through a couple of different concepts that we use in functional medicine, and in that way, listeners will get a chance to understand how it works a little bit better. So some of the principles of functional medicine are that it's a patient-centered approach, which addresses the whole person rather than just isolated set of symptoms the way Western medicine tends to do. So generally, if you go to a functional medicine practitioner, whether this is a person who has an MD degree or a DO degree, or a chiropractor, a nutritionist, a health coach, they will take time to listen to the patient's story, and while they're hearing the story, they're thinking about interactions between the patient's genetics, the environment, and how it affects the patient's genetics, also lifestyle factors that influence their health and may contribute to the complexity of their illness or disease state. And so because it handles things this way, it looks at a unique expression of the health and vitality of each individual. It's very much a science-based approach to healthcare. With functional medicine, we look a lot at the web of interactions between, say, the patient's physiology, their history, their environment, their lifestyle, their background, and thinking about that, we think about their uniqueness as an individual in terms of their genetic makeup, their constitution, their unique body, mind, spirit, and then see how external factors like their social relationships and the environment will play into their functions. So we also, go ahead.
What I'm hearing is a lot of the things that you're talking about are very, very similar to Ayurveda. So let's start connecting the two. How does Ayurveda and integrative medicine relate to each other?
Okay, so I think about basically some parallel concepts between Ayurveda and functional medicine. Ayurveda being an ancient science from many thousands of years ago, and functional medicine being a very, very modern distillation of medical science and an approach to working with a patient or a client. So they're both systems-based approaches. Ayurveda has, established different systems in the body, different functioning organs or tissues, different functioning channels, and then also an entire system for the practitioner or the doctor to evaluate the patient and their symptoms and their current state, and then go ahead and work with them through treatment to rebalance them to their natural state. So, and in functional medicine we do the same thing. We may look and evaluate different systems in the body, whether they may be the detoxification system, whether it may be inflammation, hormones, endocrine system, and so it's based on systems, but at the same time it looks at people as individuals, and it's a personalized style of medicine that appreciates the uniqueness of somebody and doesn't try to treat every patient the same. And that's something that I've found frustrating at times with Western medicine, is that if 100 people walked into my office with the same symptom, I might be encouraged, if I were following protocols, to treat them all with the same medicine, for example. And Ayurveda, of course, wouldn't do that, nor would functional medicine, because it would be looking at their unique constitution and their unique imbalance. So we have systems-based superimposed upon individualized or personalized medicine. And to be a little more specific in terms that Ayurvedic practitioners are familiar with, we look at the prakriti of the individual, their inherent constitution, and then we look at their vikriti, which is their current state of imbalance. So that's where you're looking at somebody individually. In functional medicine, we may evaluate the uniqueness of somebody's gut microbiome. We may look at their genetics and look for different mutations or variations in someone's genes that may affect their function. We may look at their nutritional biochemistry, where we assess them for nutritional deficiencies or for things that are missing in their diet, and we're testing for this, and so we're then customizing the treatment for that individual.
So basically both approaches are very, very individualized, and there's no general advice that you would give to everyone.
Well, like I said, it's individualized, but it's founded on systematic principles.
Okay.
And that's what I think is so beautiful about both systems, despite the fact that they're thousands of years apart in their origin. Ayurveda.
Yeah, that's really cool.
An herb will always have a certain property. For example, there's a rasa, virya, and vipak of an herb that will never change, but then who you use the herb in and in what time of the year may change according to what you're seeing with the patient or the client in front of you.
Yeah. So how can a modern person use Ayurveda in their life, whether it's family life or just kind of day-to-day living, if they're not necessarily going to a functional or integrative doctor and getting a whole bunch of tests done?
Right. Well, I mean, I think this is the beauty. One of the beautiful things about Ayurveda is that, it's such a beautiful system that has had so many thousands of years of trial to prove its value, that somebody can learn principles of Ayurveda just from educational YouTube videos like this one, or from their local Ayurveda practitioner, and then start applying those principles in their daily life without necessarily needing to work with an advanced level practitioner, and not even necessarily needing to do testing the way we think of as in Western or modern medicine, where we have to take blood or urine or other body fluids to test or do x-rays, etc. So I like to tell my patients that Ayurveda is about getting in touch with the laws of nature. or back in touch with the laws of nature, because we've kind of lost that knowledge by living in such a fast-paced modern society. And so we need to go through our life observing what's around us, observing the qualities, observing the conditions that we see in nature, and seeing how our body, but not just our body, our mind and our spirit are interacting with the world around us. And I think one of the things Ayurveda teaches us so well is how to adjust to what our environment is. And you have to make constant adjustments. Every day we make so many choices about what we say, what we think, what we eat, what we do, and Ayurveda teaches us how to make those choices in a way that's right for us and right for not just us, but then the greater society and our local communities.
So, like, let's make it a little bit more specific so people can actually understand what you're talking about. Tell us, maybe in the last week or today, what did you do specifically to stay in balance or in tune with your environment, with the nature?
Right, right.
Something specific, like what did you eat? What did you drink?
Sure. Well, so for us here in the desert Southwest, this time of year, it's very hot. We've had temperatures in the 90s. And so the choices I make in my diet are that I'm going to eat cooling foods. This would be a time of the year that I would eat more fruit, for example, than I normally would eat. I'm going to eat smaller meals because the digestive fire is dispersed and not concentrated in the gut, so I don't have as much power of digestion as I may have in the middle of winter. Furthermore, when I may use other cooling modalities like certain essential oils that I put on my skin in the morning. I make sure I stay extra hydrated and use cooling beverages just to avoid overheating now in the summer, because if I do that, then that will just have a cascade effect as the seasons change. If I have too much heat that accumulated now, then I might get too dry in the fall, which is Vata time, and then I could end up getting too wet in the spring as a result. So for me, a lot of it is food choice, and then also practices. If I feel like I'm overheated, I may go outside at night. We have full moon now, so just even being outside in the cooler evening and nighttime air under the moon has a cooling effect. I may do more cooling breathing techniques at home. And I also watch out that I don't overheat with lifestyle. It's not necessarily a good time of year to stay up late and be taking on too much sun in the middle of the day. So you think about the qualities of the season and then counteracting them in terms of what your exposure is.
Yeah. So that's great. So food is important. What you do is important. A lot of people will go for herbs or supplements to balance their body. What do you think about that from perspective of Ayurveda and integrative medicine?
Well, I think ideally we would not need to supplement with any herbs, compounds. However, I think we're living in a different world than our ancestors were, in the sense that, for one, we have depletion of nutrients in the soil. So the way we're growing our crops, the soil that the crops are grown on, the fact that we tend to not multi-crop on the land. Our farmers tend to grow a single crop in a single season on the land, and that will actually take nutrients out of the soil. And so I think it is important for a lot of people to take supplements. Of course, quality is important, and you definitely want to know your source. So if you're going to take an herb, a company like Banyan Botanicals with its good manufacturing practices and healthy and clean sources is a lot better than going to the store and buying something that you know nothing about the company and what may be added to that product. So there's the soil depletion issue, and then also, like I was talking about before, because we're out of touch with the laws of nature, we don't lead a lifestyle that allows us to get the right nutrients at the right time of the year. Many people don't rotate what they're eating according to the season, even though that's what nature intended us to do. Many people fail to get sun exposure in the summer, which is the only time of the year you really make vitamin D, because we're all working inside under artificial light, so we may need to supplement with vitamin D. A lot of us come from an ancestry that typically would live in a maritime environment near the ocean or near rivers, so we would be eating a lot of fish, so we'd be getting a lot of omega-3 fatty acids. We don't do that, so we may have to supplement with those. So I think we need to look at how our lifestyle and our environment has changed due to society and see how that then makes us disconnected from what we are meant to be doing ancestrally, and the genetics and the microbiome haven't caught up to the rapidly changing lifestyle, so we may need a little help from adding in certain herbs and supplements and compounds to give us that edge.
Yeah, that's really helpful. It makes perfect sense that you want to use herbs and supplements to stay balanced.
Absolutely. And the interesting thing about, when you think about herbs, as opposed to individualized vitamins, minerals, and compounds, when you use herbs, this is medicine in its natural form, that you get not just the individual vitamins, minerals, and compounds, but you get multiple vitamins, minerals, and compounds that were created in nature in one plant, for example. And so there are pleiotropic effects on the body and a natural intelligence that is held in that plant, for example, that you wouldn't necessarily get if you isolated the compounds and took them by themselves.
Perfect. Yeah, so whole food, whole herb is always better.
I agree, with the exception or the caveat that if you really are deficient and you need to dose the nutrient at a high level because of what you're lacking, it can be difficult to get the right amount by only using whole foods or whole herbs, in which case sometimes we have to look to standardized extracts or basically taking things in not just supplemental form, but also using these foods in our diet so that we can get a large amount. Because it's only so big that you can make a tablet or a pill. So you have to not forget that diet is very important as well.
Cool, that's a very helpful clarification. So Eric, where can people find out more information about you or your work, or maybe sign up for a consultation?
Well, if they're local, they can come see me in the office in New Mexico. Otherwise, my website is drgrasser.com. That's drgrasser.com. Also, if you search for Unity Medicine, you'll find me. Facebook link is there as well. I post a lot of blogs and information on Facebook, and also there's lectures on the website that I've pre-recorded for other forums that you can listen to as well.
Cool. Well, thank you for being with us tonight, and thanks for sharing all your tips.
You're welcome, Nadia. Thank you.